Hello everyone. Today's video is about how to support collagen without taking a collagen supplement. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So recently there's been a lot of comments and interest around some of the videos that I've been posting about high-dose sulfur therapy, which is where we use a supplement called MSM, which is methyl sulfonyl and there's just been a lot of comments and views and all that on my interview that I had with Dr. Kathleen Janelle, who's one of the leading experts on MSM, and a lot of folks posting their little kind of mini testimonials in the comment section about how MSM has really helped with their joint pain or their energy levels or their digestive issues, and so happy to see all of those positive outcomes that folks are posting about, and then a bunch of people saying like, oh, I'm going to try this now, and of course, not giving any. We weren't giving any medical advice during that interview, so presumably those folks are working with their healthcare provider, or maybe not. Maybe they're just taking it on their own. But of course, we're not recommending that. But it's a very widely available supplement. So really happy to see all that positive feedback. And so kind of because of all that feedback that I've been getting via my YouTube channel on that particular topic. And then also based on a couple of patients that I've seen recently, I wanted to post a video about ways that we can support collagen without actually taking a collagen supplement. Now, the punchline is that MSM, high-dose sulfur therapy, is one of the most effective, it's the most effective treatment that I've seen for supporting collagen. And what I've seen in clinical practice is many patients come in, they're taking a collagen supplement because collagen is a very popular supplement that folks take, and I ask patients, is this helping? And sometimes patients say that yes, this collagen is really helping my X, Y, or Z. It's really helping my joints. It's really helping my hair. It's really helping my skin. It's helping my nails. And that's wonderful. When supplements are helping, then fantastic. That's great. However, the vast majority of patients, I would say at least 90% of patients who come to see me and they're taking collagen already, I ask them, how's the collagen going for you? And you're like, yeah, I've been on it for a few months, I've been on it for a year, I've been on it for 2 years, and like, I haven't really seen any difference with it. But I'm still taking it because Dr. So-and-so or this or that person like on the internet or whoever said like it was good to take, so I'm just kind of taking it for good measure. And it's all well and good. To my understanding, collagen is a very safe thing to take, but it's very rare that it moves the needle. Now, I have some patients where I have found that adding collagen into a treatment protocol to help prepare for surgery and for surgery recovery, I have seen some benefit with the collagen in those cases. Now, I'm usually combining that with B vitamins and a multi-mineral, making sure they're getting adequate protein. So it's not just a monotherapy, but I feel that there have been some patients where adding in the collagen seems to be of greater benefit. So I do think that there are types of patients or subsets of patients who can certain indications, certain medical issues where collagen can be helpful, but a lot of the time it doesn't really seem to help. And just for clarification, if you're watching this thinking like, but there's this fancy collagen that like it's the best of the best, and maybe that's why you're not seeing these good results. Like my patients have come in taking a wide range of different supplements, collagen supplements, like Bend collagen, and there's other fancier brands too. Bend's the only one I can think of, so not trying to throw Bend under the bus. They're one of the higher end ones that are out there, to my understanding. Various collagen types, and I really haven't seen them move the needle very often. However, when I started working with high-dose sulfur therapy, thanks to Dr. Janelle's lecturing on the topic, I started inadvertently seeing all these positive changes with symptoms that we would normally hope the collagen would help with. So patients, say taking their MSM for their digestive issues, like for their SIBO or their bloating issues or whatever, and coming back and saying like, my bloating's doing better, and man, my hair is just like growing like crazy, or like my hair was thinning and now it's not, or my nails are growing like crazy. Like just seeing these really significant benefits to hair, skin, and nails, which again is a major reason why a lot of folks take collagen in the first place, but seeing a much more reliable benefit to those tissues, those structures, from the high-dose MSM. And again, like it wasn't just like one or two patients, like it was maybe like a couple dozen patients who have just, without me asking, saying, how's your hair doing, by the way, just volunteering that information, like, by the way, like my nails are growing like crazy, my skin is doing so much better, my hair is doing so much better. So now why would that make sense? Like why would MSM have any bearing on collagen? Well, MSM is about 30% sulfur by weight, so it's a very good source of sulfur. It's like the best, to my understanding, the best sulfur supplement out there, the most available sulfur supplement. And collagen should be riddled with disulfide bonds. So sulfur is a very important component of the integrity of collagen. And so when we take MSM, we're taking sulfur, and we are ultimately getting the substrate or the substance, the backbone that we need in order to make that nice healthy collagen. And so it would appear, clinically at least, that a lot of the connective tissue issues, a lot of the collagen issues the patients might be having seem to be related more to a sulfur deficiency. Now, a question might arise in your mind of, well, why wouldn't the collagen help? Like, why shouldn't there be sulfur in the collagen that one is taking as a supplement? And the answer is yes. However, my understanding is that when we take collagen, we're not actually taking like preformed collagen. My understanding is that the collagen, when it is, oh my gosh, what's the word? Oh, shoot. Anyways, it's like a hydrolyzed collagen. It's broken down into its constituent amino acids. And so the body then has to rebuild the collagen from those constituent amino acid parts. The main amino acids that make up collagen are, oh my gosh, I think it's proline, hydroxyproline, and lysine. I believe those are the three like most common ones. Like those are the most important, and I think maybe glycine as well. And so none of those are actually sulfur-containing amino acids. The sulfur-containing amino acids are cysteine and methionine. So my presumption is that when we have that hydrolyzed collagen, we're getting those amino acid substrates, but maybe during part of the hydrolyzation process, the manufacturing process, we're losing that sulfur, would be my best guess. I don't know for sure, and I'm not sure if anyone who studied that, if anybody watching knows the answer, I'd love to hear about it, but I've not gone down that rabbit hole of figuring that out yet. So I think that's why there's that difference. But I can just tell you clinically, the high dose sulfur, the MSM supplement, it has really made a big difference for a lot of folks. So to the point where folks come in with, brittle nails, thinning hair, I don't really treat cosmetic skin issues, but if someone's like, oh, is there anything I could take for my skin, or like my skin just seems to be a little like it's not as it's kind of losing some of its elasticity, that's not what I hear too often because I don't have a cosmetic based practice. But for thinning hair, hair loss, not like male pattern baldness, but just sort of thinning hair or sort of hair loss for maybe like other metabolic reasons that are not related to male pattern hair loss, or nail issues, I prescribed the MSM for many of those cases. It's made a really, really big difference. It's my go-to therapy for that. I'm just going to say one other thing. I'm sure it'll come back to me at some point, but it might come back to me in another future video. So anyways, yeah, long and short of it is, oh shoot, I almost had it again. Darn it. Anyways, MSM, very, very helpful for collagen-related issues in my experience, and yeah, it's been much more effective than supplementing with collagen directly. I remember what it is now. There it is. So as far as joint-related issues go, I've also seen a lot of benefit with MSM for joint pain. Now, it's not a panacea. I would love to say that 90+% of patients benefit from high-dose sulfur for their joint-related issues, but the track record has not been as good, unfortunately. So I would say for hair and nail issues, I'm probably batting probably 900. Like it's pretty darn good. With respect to joint related issues or inflammation issues, like muscle inflammation or whatnot, it's probably more like in the 70-ish% range for seeing benefit there. So it has been very helpful for some, but I have some patients where they do better with their glucosamine, their chondroitin, those types of joint supports as opposed to the MSM. So I'll sometimes use it in combination. So not a panacea for those cases, but it has been incredibly helpful for a lot of folks with chronic joint or muscle related pain issues. Again, I've really not seen the needle move in a meaningful way with collagen for those types of symptoms, except in very rare cases. Anyways, I will leave it there for now. If you don't mind, please taking a quick moment to like, share, subscribe, and/or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. If you have any questions or comments on this topic or anything else, just post it in the comment section below, and I will do my best to answer as soon as I can.